Good evening, friends. Today I am starting the talk on infant and young child feeding. It is an important topic for MBBS graduates as well as the PG students of pediatrics. And it is a very concise and brief talk about feeding of the child for the first 1000 days. So, WHO has defined the first 1000 days window as the most critical window of child's growth period. This includes 270 days of pregnancy and 730 days of first 2 years, because it has been found across various studies that most of the nutritional insult of stunting and wasting occurs in these first 2 years, which contributes largely to the morbidity and mortality among children. And with the good use of IYCF practices, 50% reduction of these morbidity and mortality can be achieved. So we have three pillars of IYCF, infant and young child feeding. First is the golden hour, that is the beginning of the life. Here it is about early initiation of breastfeeding within the first hour of the birth, which has been proven to result in sustained breastfeeding and resulting in good growth and passive immunization of the child. Up to 6 months, no food or fluid except breastfeeding, and this is most essential for baby because it meets the biological needs of the child at this age, as well as protects from various infections and provides adequate nutrients. Next period is 6 months to 2 years of age. Here complementary feeding should be introduced by 6 months of age, and that is the most critical step in a proper IYCF strategy. So as we said earlier, that the first hour of the life is the golden hour. Initiate breastfeeding as soon as the mother and baby are ready, within first 60 minutes, as soon as possible, even in cesarean cases. And this is the golden time that all the reflexes of the mother related to breastfeeding are switched on, which are prolactin and oxytocin reflex, and this results in success of breastfeeding for the first 6 months. You all know that breastfeeding gives the passive immunization against infections. It also provides a flush to the GI tract and prevents a lot of jaundice, and highly concentrated in vitamin A and other micronutrients which are crucial for eye and brain development. In the first 6 months, there should be exclusively breastfeeding and no food or fluid, that is, nothing else rule applies. Maybe some medicines which are essentially prescribed by the doctors, and the big reason is that even the clean water fails to provide safety. It can result in lot of malnutrition, dilution of the milk, as well as infections. Animal milk can introduce allergies or infections, and the patient can have added problems. The iron in the breastfeeding is low, but surprisingly, the nature has provided a good bioavailability for that, and the baby does not develop any significant problems because of iron deficiency. So, as the baby is allowed to suckle on the breast more is the milk output, and that is the factor which results in good breastfeeding for the first 6 months. After 6 months, the problem is that the energy and the nutrients provided only by the breast milk are not sufficient to meet the total energy needs, and this results in energy gap which keeps on widening as the child grows up to 24 months. And we commonly encounter cases in our hospitals where there is no food or any other item provided to the child except breastfeeding, or even a worst case that diluted animal milk is being given. So that results in the huge energy gap resulting into the malnutrition. So the common question in parents' mind is, what should I give, how should I give, and how frequently should I give? So we should remember that the stomach of the child is very small. That is why only small amounts can be given, and it is essential that we make them energy dense. So watery foods will make the child's stomach full, but they will deprive him of nutrition. So the basic thumb rule is that the food item should not slip off from the spoon easily. It should be thick enough to stay on the spoon when held vertically. So thick mashed semi-solid consistency foods can be given. Often the mistake committed in the homes is to give dal water or rice water, which is very poor in nutrition quality. Boiled rice and boiled dal mashed can be given, and they provide more nutrition if we add some oil or ghee to it. All the food items commonly available at our home, which can be given in a boiled, mashed, soft form, contain minerals like iron, zinc, iodine, and vitamin A, which are crucial for general growth of the body tissues also. So, from 6 months to 9 months, we give 2 to 3 spoons at a time. Start with that and increase to half katori by 9 months. Initially, to start with, we can give twice or thrice a day, along with once or twice snacks. Mashed, thick consistency food which stays on the spoon should always be remembered. From 9 months up to 12 months, the minimum amount should be half katori to 3/4 katori. We can increase the meals from 3 to 4 with 1 to 2 snacks in a day. Mashed or finely chopped, which are easily chewable items which the child can hold in mouth, are given. It should be remembered that large particles should not be given because of the risk of choking. 1 year up to 2 years, 1 katori food is to be given as 3 to 4 meals a day, along with once or twice snacks, and mashed or chopped form prepared, and the family eats together along with the child. So while feeding the child, it is very important that the caregiver should be actively looking at the child, good eye-to-eye contact, verbal cues, talking to child. These not only engage the child beautifully in feeding, but also help in development of hearing and speech. The feelings of affection also are developed by this, and often the child is fussy or angry, and we make an error of forcing the child to eat the food. Rather than that, practice patience and always use play methods or smile with the child to encourage the biting. Whenever a child refuses to eat some item, don't repeat it next day. Repeat it after a gap of 10 days to 2 weeks. And another mistake is that during illness, the children lose appetite. We all lose some appetite, but we need nutrients to fight off the disease. So that is the opportunity when the children should be given their favorite foods in a smaller but more frequent amounts, and use the softer texture foods. Whenever we encounter a mother who has a child in this age group of 6 months to 2 years, we should always assess, ask her the critical questions, observe the child and the mother's feeding practices, and mentally analyze what are the challenges the mother and baby are facing. And accordingly, with the data obtained by the interview, we give the mother the advice for further action. We should always praise the mother and advise her for any mistakes to be corrected or any doubts to be cleared off. So this is known as AAA model of individual counseling. The other is when in institutions like hospitals or Anganwadis we have a group of mothers like this. We use the OTTS strategy, that is observe, think, try and share. So this is the framework which is used in group teaching or group counseling. It is always important that we counsel the mothers with empathy. The idea is not to just to transmit the knowledge alone, but along with that knowledge, the mother should develop confidence in what she is doing or in what she is told to do. We should always accept with full intent of listening what the mother feels before correcting their information. We should use the non-verbal techniques of communicating with our body language, and good communication strategy works wonders in improvement of the mother's strategy. So the key takeaways from this talk is that we should have a sound knowledge about when should we start the complementary feeding, for how long we should keep on giving the complementary feeding, how frequently we should give, and what items we should give. We should also develop good counseling techniques. Reprimanding the mothers or threatening them by their faults is never productive in good IYCF program. We should have a structured framework in our hospitals. A designated person is ideal who should guide and counsel these mothers, and we should have a framework in our OPD or hospital where we monitor the growth of the child, and if any child falters in growth, we should seriously think that there may be a problem with feeding techniques of the family. So I conclude this small talk on IYCF, and this is just to brief you that we need to make more and more efforts for success of breastfeeding. It should be initiated in the first hour. At 6 months, we should stop using the word weaning. We should add complementary feeding to breastfeeding. The breastfeeding should continue till 2 years of age, and the complementary feeding is increased gradually from 6 months onwards, and we should monitor the child's growth repeatedly every 3 months. Along with that, we assess for other medical issues like development and nutritional deficiencies. So thank you for watching this video, and thank you for watching earlier videos also, which have been liked and praised by the audience. Thank you once again.